Look at your nails right now. No, seriously. Right now, while you're watching this. Hold your hand up and look. Because there's something your nails may already be showing you, and almost no one is paying attention to it. Not your doctor. Not your dermatologist. Probably not you, either. And I'm not talking about a fungal infection or low iron. I'm talking about a pattern. A subtle, specific cluster of changes that can appear at the edges of your nails, around your cuticles, and in the skin just underneath. Changes that have been showing up in people with conditions most of them didn't even know they had. Conditions like Sjögren syndrome. And thyroid dysfunction. And before you say I've never heard of that, or my labs came back fine, that's exactly the problem. Because here's what most people don't know, your nails can be showing signs of something deeper months, sometimes years, before it ever shows up in your blood work. Before your labs flag it. Before your doctor names it. Before you even have the language to describe what's wrong. Your nails already know. And today, I'm going to show you what to look for, and why it matters more than you think. And if that sentence just landed for you, if something in what I've described so far sounds familiar, I've put together a symptom map that shows exactly how this condition progresses, what shows up at each stage, and where the standard tests are most likely to miss it. Type symptom map in the comments right now and I'll send it to you directly. Because what I'm about to show you next is why that map matters more than most people realize, and why the stage you're in changes everything about what happens next. Keep your hand up. Or grab it now if you haven't. I want you to look at a few specific things. First, look at the very bottom of each nail. Right where the nail meets the skin. Do you see a small white half-moon shape at the base? That's called the lunula. Count how many you have across all 10 fingers. If everything is working the way it should, you should have at least 8. If you have fewer than 8, or if some of them have disappeared entirely, that's your first signal. Now look at the surface of your nails. Run a fingertip across them. Do you feel fine raised lines running from the base of the nail to the tip? Those are vertical ridges. Make a note of whether you have them. Now look at the very tips. Are they peeling apart in layers, not chipping, but splitting? Like the layers of the nail are separating from each other? And finally, look at the skin right where your nail meets your finger. That fold of skin at the base. Is it slightly ragged? Any persistent low-grade redness? Any tiny brownish specks sitting right at that edge, like very small bruises that never fully resolved? Some of you are already nodding. Some of you have been writing these things off for years. These are not random signs. They form a pattern. And that pattern, across multiple findings, across multiple nails, points to something specific happening inside your body. But before I explain what, I want to make sure you understand why this matters so much. Here's the thing most people don't realize. Your nails are one of the most metabolically responsive tissues in your body. They grow constantly. They require a steady supply of nutrients, hormones, and blood flow to do that. And when something disrupts that supply, whether it's a hormonal problem, an immune problem, or a circulation problem, the nails are one of the first places where it shows up visibly. Think of your nails like a running record of what's been happening inside your body over the last few months. Every line, every split, every missing moon, every change in texture, it's data. And right now, most of that data is going unread. Let me start with the thyroid piece, because it's the one that surprises people most. Your thyroid produces hormones that regulate energy production in nearly every cell in your body. When your thyroid is struggling, specifically when your active thyroid hormone called T3 is low, your body has to make decisions about where to send its limited energy. Non-essential tissues are the first to get cut off. Your hair. Your skin. Your nails. This is why so many people with thyroid dysfunction walk around with brittle nails, thinning hair, and persistently dry skin, and get told it's just aging, or stress, or a vitamin deficiency. Sometimes it is a vitamin deficiency. But the vitamin deficiency is caused by the thyroid problem, not the other way around. Here's how that chain works. Low thyroid function suppresses the production of stomach acid. Your stomach acid is what breaks down food and extracts the nutrients from it, specifically iron and B vitamins. So even if you're eating well, even if you're taking supplements, if your stomach acid is low, your body can't absorb what it needs. The result? Vertical ridges in your nails. Because vertical ridges are a direct sign that your nails are not getting the nutrients, particularly iron and B vitamins, that they need to grow properly. And it all starts upstream, with the thyroid. Now let's talk about the missing moons. If your lunula has shrunk or disappeared from several fingers, your body is telling you something specific. T3 is too low. The lunula tends to disappear when energy production at the cellular level drops, and that's a T3 problem, not just a general thyroid problem. This is important because a lot of people on thyroid medication still have this sign. Why? Because the most common thyroid medication, levothyroxine, only contains T4. And T4 is not the active form. Your body has to convert T4 into T3. And many people are not making that conversion efficiently. So their TSH looks normal on paper. Their doctor says the labs are fine. But their free T3 is low. And their nails are telling the story that the labs are missing. The same logic applies to nail splitting. When T3 drops, it affects oil production in the nails and skin. Your nails start to dry out from the inside. They lose the internal moisture that holds the layers together. And they begin to split. If you have nail splitting, vertical ridges, and missing moons, especially together, that's a pattern that points toward a T3 problem. Not a cosmetic problem. Not bad luck. A hormonal signal that your body has been sending you, possibly for a long time. But here's where it gets more layered. Because some of those nail signs we just talked about, especially the changes in the nail fold, the low-level redness, the subtle puffiness, the tiny hemorrhage-like specks, those don't come from thyroid dysfunction alone. They come from something else entirely. And this is where the second piece comes in. Your nail fold, that fold of skin at the very base of your nail, contains a network of tiny blood vessels called capillaries. Under magnification, doctors can actually look at these capillaries and assess whether they are healthy. The technique is called nail fold capillaroscopy. And in specialized rheumatology centers, it's used as a window into the health of your microcirculation, the smallest blood vessels in your body. In healthy tissue, those capillaries are uniform, evenly spaced, and consistent. In people with certain autoimmune conditions, they are not. The vessels become fewer in number, more spread apart. And the surrounding tissue shows subtle but measurable changes. One of those conditions is Sjögren's syndrome. Sjögren's is a chronic autoimmune disease that primarily attacks your moisture-producing glands, your tear glands, your salivary glands, and others. The classic symptoms are dry eyes and dry mouth. But Sjögren's also affects small blood vessels. And that vascular involvement is what shows up in the nail fold. Published research shows that people with Sjögren's have measurably lower capillary density in the nail fold compared to healthy controls. Fewer blood vessels per millimeter of tissue. And the people with the most pronounced nail fold changes tend to be the ones who also have Raynaud's phenomenon, where the fingers turn white, then blue, then red in the cold as circulation struggles to respond normally. Between 10 and 30% of people with Sjögren's experience Raynaud's. And most of them had no idea why their hands behaved that way for years. Now here's what makes this complicated, and important. Thyroid dysfunction and Sjögren's syndrome are not the same thing. But they are connected in more ways than most people realize. Autoimmune thyroid disease, where the immune system attacks the thyroid, is one of the most common autoimmune conditions in the world. And autoimmune diseases tend to cluster. When someone has one autoimmune condition, their risk of developing a second one is significantly elevated. Sjögren's and autoimmune thyroid disease frequently occur together. Some researchers estimate that thyroid involvement is present in 10 to 15% of people with primary Sjögren's, and possibly more who go undiagnosed. So when you're looking at a set of nail signs, missing moons, vertical ridges, splitting tips, ragged nail folds, persistent redness at the base, you may not be looking at one problem. You may be looking at two overlapping conditions that have been quietly running in the background, each making the other harder to see clearly. And the nails are showing you both. Let me walk you through what each sign may be pointing to, because the pattern matters. Missing lunula, fewer than 8 moons across your fingers. This is primarily a T3 signal. Your cellular energy production is low. Your body has deprioritized nail tissue. If you're on levothyroxine and still have this sign, it may mean your T4 is not converting to T3 efficiently. Vertical ridges, fine lines running from base to tip, visible or feelable. This is a nutrient absorption signal, specifically iron and B vitamins. The most common cause in people with thyroid dysfunction is low stomach acid reducing absorption. Before supplementing iron, test your serum iron and ferritin. 4 B vitamins. Most thyroid patients benefit from a B complex regardless of whether they've been formally tested. Nail splitting, tips peeling apart in layers. This is an oil production and T3 signal. When T3 drops, sebum production in the nails decreases. The nail layers lose their internal cohesion. Topical oil applied directly to the nail can help manage the symptom. But the root fix is T3 status. Nail fold changes, ragged cuticle edges, persistent low-grade redness, tiny brownish specks, or a slight puffiness at the base of the nail. This is a microvascular and potentially autoimmune signal. These changes are associated with conditions like Sjögren's and early systemic sclerosis. If you have these changes alongside dry eyes, dry mouth, cold fingers, or unexplained fatigue, that combination deserves a rheumatology referral. Now I want to be direct with you about something. None of this is a diagnosis. Vertical ridges can come from iron deficiency alone. Splitting nails can come from too much water exposure, harsh chemicals, or age. Missing moons can appear in people who are otherwise healthy. Nail fold redness can be a local skin irritation. These signs are not proof of anything on their own. What they are, especially in combination, especially alongside other symptoms, is a reason to look further. A reason to get the right labs. A reason to see the right doctors. And a reason not to accept everything looks fine as a final answer when your body is clearly telling you otherwise. If you've been living with fatigue that sleep doesn't fix, dry eyes, dry mouth, cold hands, brittle nails, and a general sense that something isn't right, and you've been told your labs are normal, there are specific things worth asking for. For thyroid, TSH, free T3, free T4, reverse T3, thyroglobulin antibody, thyroid peroxidase antibody, serum iron, and ferritin. Not just TSH alone. The full picture. For autoimmune and vascular, anti-SSA, anti-SSB, ANA panel. If nail fold changes are present and persistent, a referral to a rheumatologist for capillaroscopy evaluation is worth asking about specifically. Because whether we are talking about thyroid dysfunction or Sjögren's or both, the earlier it's identified, the better the outcomes. I want to pause here for a moment. Because some of you watching this aren't just casually curious. Some of you have been living with something that doesn't have a name yet. You've been tired in a way that sleep doesn't fix. Your eyes feel gritty. Your mouth is dry even when you're drinking enough water. Your hands feel different. Your nails have been changing and you didn't know what to make of it. And you've brought these things to someone. And been told it's fine. Or you've been handed a referral that led nowhere. Or you've been told to take vitamins. If you've noticed changes in your body and felt like something wasn't right, that matters. Your sense that something is off is data. It's not anxiety. It's not hypochondria. It's pattern recognition. And your body has been running that pattern for a long time. The tricky thing about both thyroid dysfunction and Sjögren's is that neither one announces itself clearly. They accumulate. A dry eye here. A cracked cuticle there. Fatigue that everyone brushes off because everyone's tired. Cold hands. Nails that just don't look the way they used to. Small things, one by one, that don't seem connected. Until you connect them. The nail signs we talked about today are just one part of a larger pattern. A pattern that shows up across multiple body systems, often at the same time, often in ways that seem completely unrelated. Eyes, persistent dryness. Grittiness. A feeling like there's something in your eye even when there isn't. Light sensitivity that gets worse over time. Mouth, dryness that isn't fixed by drinking water. Difficulty swallowing dry foods. Increased dental issues because saliva isn't protecting the enamel. A sensation that your tongue sticks slightly to the roof of your mouth. Skin, chronically dry skin that doesn't respond well to moisturizer. Not flaky like eczema. Just persistently dry. Especially on the hands, arms, and legs. Fatigue, a heaviness that doesn't lift after sleep. It interferes with concentration. It can feel like your body is running on a lower battery than it should be. Many people describe it as feeling like they have a low-grade flu that never fully arrives and never fully leaves. Joints, a persistent low-grade ache, especially in smaller joints in the hands and feet. Not always swollen. Not always dramatic. Just there, quietly, most days. Nervous system, tingling, numbness, or a buzzing sensation in the extremities. The same microvascular changes that show up in the nail fold can affect tiny nerve pathways, particularly in the hands and feet. All of those symptoms, every single one, can be explained away individually. Tired? Stress? Dry eyes? Too much screen time? Achy joints? Age? Tingling hands? Sleeping on your arm wrong? But together, they form a pattern. A pattern that has a name. And if you're sitting here ticking off 3, 4, 5 of those, that's not coincidence. That's information. This is exactly why I put together the symptom map. It takes everything we just covered, the nail signs, the eye signs, the mouth, the skin, the fatigue, the joints, the nervous system, and lays it all out visually so you can see how it connects. A lot of people print it out and bring it to their appointment. Because walking in with a clear picture of your pattern is completely different from trying to explain it from memory while someone is already reaching for the door. Type symptom map in the comments and I'll send it to you. Because most people notice one sign and miss how everything connects. The map shows you the connections. Here's something I want to leave you with. The nails are just one window. There are other early signs that most people miss completely, not because they are not paying attention, but because these signs don't look the way they think disease is supposed to look. There's one that shows up in your mouth, not as dryness, but as something you'd notice in the morning and probably dismiss within 30 seconds. There's one that shows up in your eyes, not as redness, but as something that happens when you look at light. There's one that shows up in your sleep, not as insomnia, but as a very specific pattern of waking that people chalk up to getting older. And there's one that shows up in the way your joints feel specifically in the morning, that almost nobody connects to what's happening in their immune system or their thyroid. Each of these, on its own, is easy to dismiss. Together, alongside what you now know about the nails, they form something you can actually bring to a doctor and say, here's what I've been experiencing, here's the pattern, I need someone to take this seriously. The next video covers all of those signs. In the same detail. With the same respect for the fact that you've probably already noticed some of them, and been told not to worry. Subscribe so you don't miss it. Because the earlier you see the pattern, the more options you have. One more thing before I go. If you've been noticing changes, in your nails, your energy, your eyes, your skin, your hands, and you've brought those things to someone and been told everything looks fine. You are not imagining it. The signs are real. The research is real. The pattern is real. There are doctors who know how to look for this, rheumatologists, endocrinologists, and internal medicine doctors who specialize in complex presentations where multiple systems are involved at once. What you need is someone who looks at the whole picture, not just the individual pieces. Type symptom map in the comments and I'll send it over. It gives you a visual of the full pattern, something concrete you can bring to an appointment instead of a vague feeling that something isn't right. Because that conversation changes when you walk in prepared. In the comments, tell me, when you looked at your nails at the start of this video, what did you notice? Have you ever been told your labs were fine when you knew something wasn't right? Or are you just now starting to connect the dots? Drop it below. I read every comment. And if you want the symptom map, type symptom map and I'll send it over. See you in the next one.